All right, to a little more, not more serious, because death is death is death, but this is serious for us nurses in the workplace. So we know that the Me Too movement's happening, okay? But in the workplace, for us nurses, it's a little bit different, all right? So NBC News, and I give it up to them because I loved this this article, this report. They interviewed a nurse, Meghann Justice, who works in an emergency room, and I'm pretty sure she's a travel nurse. And they asked her a couple of questions about sexual harassment in the workplace. And not only is it a story about her, yeah, she has some anecdotal, stories that she told, but they also looked at major studies that have shown that sexual harassment in healthcare providers' workplaces is horrendous. Is it more on the female side versus the male side? Of course! Of course it is. As a male nurse, do I know what sexual harassment is at work? No, I can honestly say I don't think I've been sexually harassed at work. Which is a great thing. Which is something every nurse, every healthcare provider should be able to say. I'm lucky that I haven't. Because once you look at these numbers, it's like, holy shit, how? Even for the men, it's crazy. But for the women, it's the majority. And it's not even a question. It's scary. All right, let's get there. All right, so Meghann Justice is an emergency room nurse, and she says that she's been called things like cute little thing, or patients have exposed themselves to her, especially when she's in the emergency room and she's putting in an IV and she has to lean over the patient. She says that these patients come into the hospital inebriated. They come in drunk. They come in after they use some crazy drugs or just super ill. And like when she does things like put in an IV, when she does things like has to put on someone's telly and has to get really close to the patient, these patients sometimes do the crazy thing of thinking they could go ahead and grab a boob, get a quick squeeze in. It's insane. Absolutely insane. You put your scrubs on every morning, you go to work because you want to help these patients, and while you're helping these patients, they put you through that. Bullshit. Absolute bullshit. All right? But it's not just the patients, and we're going to get back to the patients because with the patients, like I said, they are those caveats where, they're ill, they're sick, they're drunk, they're induced. It doesn't give them a pass. It's a zero pass. Absolutely not. But we're going to get back to that. What we also need to talk about is the sexual harassment nurses and other healthcare providers, mainly female healthcare providers, face when they're in the workplace from other co-workers. Yes, I'm talking to us men. Us men, you and me in the healthcare field. It is our fault. Our fault, all right? So, in the study, in the NBC News reported inappropriate conduct from their male peers or supervisors. Over the course of 7 months, women residents, nurses, and surgeons told NBC News about rampant misconduct, including vulgar comments from male physicians whispered to them in the operating rooms of anesthetized patients, propositions in hospital call rooms, and questions about their bra sizes from male coworkers. Really? Really, though? Like, really? Bra sizes? I mean, 7th grade? Really? Come on. So yes, a study from Medscape was done on this exact topic on sexual harassment in the workplace, but it focused again on patients, not from coworkers, and it was done for both men and women, and the numbers are drastic, and this is what I was talking about in the beginning. So a Medscape poll asking whether these healthcare providers have been sexually harassed, they found that many more nurses, 71%, compared to physicians, 47% said yes. The poll questioned 1,455 people, 569 of which were nurses, 408 were physicians, and 68 were just some form of healthcare provider. And then they split it up by genders, and it's drastic. So 73% of female nurses versus 46% of male nurses had said yes, they had been harassed at work, and then 58% of female physicians versus 39% of male physicians has said yes, they have been harassed at work. And that's gross in every way possible. And again, those are just the numbers from the patients, and that is only asking 1,000 nurses, physicians, and healthcare professionals. That is, because I've been a male nurse and I've heard the stories in like the nurses station. I've heard the stories when we go out after work. It happens all the time. Not to me. And I think it's crazy because I don't know. Yeah, I'm always in like an awkward position at work, but I'm in an awkward position when I'm helping clean someone up, right? I'm in an awkward position when I have to take someone to the bathroom and it's awkward and I have to stand there and watch them because they might fall over. Stuff like that is my definition of an awkward situation at work. I don't know what it feels like for someone to grab my chest while I'm trying to work, help them get better. I don't know what it feels like for someone to call me like a cute little thing or do a spin for me, honey, or all this bullshit. I don't. I just don't. Right? I'm like cringe-worthy, awkward, don't know what to say when I'm in like those bathroom situations. I don't know what I would do, say, or feel in the other situations. And the worst part about this entire story is what Miss Meghann Justice said at the end. She said it's just par for the course as for female nurses. It got to the point where she gets it all the time, so often, it is just par for the course. If that's what the profession of being a nurse, which I am so proud to be, has come to, where the female counterparts have to just deal with it. Like, that's what the situation is. They just have to deal with it. I'm kind of disappointed. Yes, I've heard these stories, but I didn't know it was this much, right? I didn't know it happened so often, all day, every day. I don't know. But the thing is, I don't know what the answer is. For the coworkers, I know what the answer is for the coworkers who were sexually harassing their coworkers. Kick them out. Get fired. Get reprimanded. Whatever you have to do, go down the policy list and just do what that policy says. Because reading policies, most policies, if followed correctly, do make sense, right? I don't know word for word what our policy is, but there's some punishment that happens. You might lose your job. You might get, suspended. All of these things happen, which makes sense, which should happen. And yes, we should report these things, and I'm not saying like the victim, the person who's getting sexually harassed, even if you're just a bystander and you hear this whispering in the OR room, you stand up and say, this is bullshit. You can't do that, number one. Number two, you take it to your manager, you take it to someone in HR, you take it somewhere so that person doesn't do that again and they get in trouble the way they should get in trouble. She said, change will start once the profession of nursing as a whole is no longer sexualized, and that's a huge point. I mean, just look at any Halloween picture from any party in the history of Halloween, and there's a sexy nurse somewhere, right? And then she continues by saying the stereotype of the sexy nurse, a lot of people just have that idea in their head, even though it may not necessarily apply. Definitely not. And then lastly, we're not all wearing short little white dresses and fishnets. Amen to you, Miss Justice. Amen to you. I respect it. I love it all the way. We got to change. I don't know how. I don't know what the answer is. And then just getting back on the patient side, the only reason I say it's a little iffy there is because if you get sexually harassed at work and you work at a restaurant, you can tell that customer, get out. We don't want you here. Yeah, if you're working at a bank, you say, get out, we don't want you here. But when someone's sick, when someone's ill, when it's a patient and it's healthcare, you can't tell the patient, get out, you can't be here. You can't do that to them. Yes, you gotta be firm and say, this is not allowed. If you do this, we can't help you. Obviously, but we can never not help the patient. It is our duty as healthcare providers, as nurses, to help the patient. So that's why I say it gets a little tricky. It sucks. I don't know what the answer is, but we need to figure something out because I can't imagine it. I can't imagine, and I hated reading that it was par for the course. Par for the course, get the hell out of here. Par for the course is staying late to document. Par for the course is you might miss a lunch here and there. Par for the course should never, ever, 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 ever be sexual harassment in the workplace. All right, I'm done. I know. I'm sorry. I'm done. Moving on.